Hello, Bonjour. I'm Carson Gardner, an old family doctor and the medical director of the White Earth Tribal Health Department. Most of you guys know me. I've been asked to answer a few questions regarding the COVID-19 infection. First of all, what is the COVID-19 virus? It's a new virus in the coronavirus family. Corona means crown, and these viruses look like crowns under a very strong microscope. Many coronaviruses cause the common cold and are not serious, but there are a few bad coronaviruses. They cause things like SARS and MERS, and now COVID-19 is the new coronavirus infection that can be serious. How does a person catch COVID-19? They catch it by being coughed on or sneezed on by someone who has the infection, or by touching a surface contaminated with the virus and then touching their face, eyes, nose, mouth area. Where are the most likely places to catch coronavirus? They're public places with a lot of people, especially people crowded closely together, people who have the virus and are coughing and sneezing. How long does the coronavirus last in the air and on unclean surfaces? It lasts in the air minutes to a few hours, and it lasts on unclean surfaces like tables for hours to days. How long does it take to get sick with a coronavirus infection after you catch the virus? Maybe up to 14 days, but most people start getting sick within 5 or 6 days. What are the symptoms of coronavirus infection? The main symptoms are cough, fever, tiredness, body aches, and shortness of breath. Some people also get diarrhea. How many people on White Earth will get COVID-19 and how bad will it be? The scientists say that about 50% of the people in a community will get this infection. About 7.5% will be seriously ill. A little over 3% will need to be in an intensive care unit, and about 1% will die. To give you some numbers as an example, let's say there are 10,000 people living on White Earth lands. That means 5,000 will get this infection. Only 750 will get seriously ill. A little over 300 will need to be in an intensive care unit, and maybe 50 to 100 people will die. That's a lot of deaths. We can make that a lot better if we all practice infection control practices and social distancing. We can cut the 750 sick people down to 75, and we can cut the deaths down from 50 to 100 down to 5 to 10. That's why it's important to do infection control practices and social distancing. What are the general infection control practices? You've already heard them from many sources. Stay home if you're sick. Cover your cough with your elbow or with a tissue. Don't cough or sneeze on others. Wash your hands frequently with soap and water, or if you don't have soap and water, use an alcohol-based hand sanitizer. Clean surfaces at home frequently with a spray disinfectant. Only wear a mask if you yourself are sick and need to be close to family or to go out in public. Stay 6 feet away from sick people, or if you're sick, stay 6 feet away from people who are well. Don't touch your face area with unwashed hands. And if you get sick, call your medical provider and notify them right away. How does a person get tested for COVID-19? A medical provider needs to order the test. Usually clinics or emergency rooms will do a nose swab or a throat swab, or sometimes draw a blood sample. Soon there are going to be community drive-in testing centers in public places like store parking lots, but I think you probably still need a doctor's order when you go there. Who's at highest risk for getting COVID-19 infection and being seriously sick. Elders, people approximately over age 60, and people with chronic health problems like heart trouble, diabetes, high blood pressure, chronic lung disease, kidney disease, or slowed down immune systems like people with cancer. What is social distancing? Social distancing means staying at home. That's why schools are closing, shopping malls are closing, movie theaters are closing, why it's recommended that there be no large public gatherings of even over 10 people. Schooling at home, working at home if you can, going out in public only for food, gasoline, or for medical care, and also young, healthy people helping elders by running errands in public for them, so elders and people with chronic health problems can stay at home. Will social distancing work? If we all practice infection control practices and social distancing the way I've explained it, we may be able to cut down serious infections and deaths by 90%. It will work if we all do it together. But if people skip infection control practices and social distancing, then it won't work. Are there traditional medicines that will help decrease the risk of COVID-19? Yes, there are. Talk to our cultural division. There are traditional herbs that will decrease the chance of getting virus infections and will make the virus infections less serious if you get them. One last question. How should I take care of someone at home with COVID-19? You need to have your sick loved one wear a mask if you have to get close to them within less than 6 feet to help care for them. You need to provide them a separate bedroom and, if possible, a separate bathroom. You need to provide them with a closed lid wastebasket for their tissues. You need to wash your hands frequently with soap and water when you're caring for them. You need to wash surfaces frequently with soap and water or disinfectant when you're caring for them. You need to limit visitors. People are going to want to visit your sick loved one, but you need to limit visitors because exposure to someone sick with COVID-19 is how the virus gets passed around. And you need to stay in touch with your loved one's medical provider, because if your loved one gets worse, they may need to go from home to a hospital. All right, I hope that will be of help to you. Miigwech, meet you.